today we are going to start a topic, hip dislocation. So hip dislocation is also known as TDH, developmental dysplasia of hip. So what is dislocation of hip? If we see क्या होता है इधर, the femur and acetabulum are the joints. The femur will be setting up into the acetabular cavity, so for the proper movement of the leg. Okay, so here क्या होता है, dislocation occurs when ball shaped head of the femur comes out of the cup shaped acetabulum set in the pelvis. Okay, so जो कप शेप ऑफ acetabulum, उसमें से अगर फीमर अगर निकल जा रहा है तो देन वी कैन कॉल इट एज हिप डिसलोकेशन. सो दिस हैपेंस टू वेरिंग इन डिग्री. ये पार्शियल हो सकता है, इनकम्प्लीट या पार्शियल हो सकता है, या कंप्लीट डिस्प्लेसमेंट भी हो सकता है. सो मोस्टली कौन अफेक्ट होता है इसमें? फीमेल्स आर मोर अफेक्टेड इन दिस दैन द मेल्स. क्यों ऐसे होता है? जो हार्मोन्स जो रहता है, सो जो मेल एंड्रोजेंस दे विल प्रोटेक्ट अगेंस्ट द मैटरनल हार्मोन्स रिलैक्सिन. दिस विल कंट्रीब्यूट टू increased joint laxity in the newborn period. So the hormones which are present in the males, the male androgens, they will protect the males from forming this condition. Okay, this is the main reason why the girls are more affected than the boys. So this condition can be either congenital or acquired. If you see the definition, a dislocation is an injury in which a bone is displaced from its proper position and femur bone separated from acetabular cavity. So what happens here? The femur cannot be set up into the acetabular cavity. So this is because of complete or partial development problem, we can say. So femur comes off completely or partially from the acetabulum. So this is a condition related to abnormal development of the hip. So ये development कब हो सकता है? ये fetal life में भी हो सकता है, during fetal life or during infancy or during childhood also. Okay, this will be occurring because of the developmental abnormality. So before going into the topic, we have to understand some terms to understand the topic. So abduction, here are some words. First one is abduction. Abduction क्या होता है? If we move some of our body parts away from the midline of the body. ओके, सो जब हम दूर ले जाते हैं, कोई हमारा बॉडी पार्ट्स को दूर ले जाता है या अलग करते हैं, उसको क्या बोलते हैं? अबडक्शन बोलते हैं. नेक्स्ट एडक्शन. सो ये क्या होता है? पास लाना या जोड़ना बोलते हैं. इफ़ वी आर ब्रिंगिंग आवर बॉडी पार्ट्स टुवर्ड्स द मिड लाइन, देन इट इज़ नोन एज एडक्शन. ओके, अब एडक्शन, एड का मतलब पास, एड जोड़ना. एडक्शन इज पास ले आना एंड abduction इज दूर ले जाना. ओके, नेक्स्ट इज फ्लेक्शन. व्हाट इज फ्लेक्शन? इट इज अ डिग्री ऑफ टू बोन्स will be decreasing in this. Okay, when we fold our elbow, so the degree between the arm will be, two bones will be decreased. So this is the degree of two bones will be decreasing in flexion. Next, extension. So in this, degree of two bones is going to increase. So when we extend our elbow, so the degree between the two bones will be decreased. Got it? Extension is, we have to extend. If we extend our hand, so the degree between the two bones, upper and the mid arm and the lower part of the arm, will be extending. So here the degree of the bones will be increased. So this is the extension. And prelixation. Prelixation is neither it is a subluxation or dislocation, we can say. Subluxation is incomplete dislocation. Incomplete dislocation. So यहाँ neither incomplete dislocation होता है ना पूरा dislocation होता है. So it will be very partial. So it is caused by acetabulum development delay. So in this condition क्या होता है, femur head remains in the acetabular cavity, but the acetabular cavity will be very shallow, very shallow. Okay, next is subluxation. Subluxation is this is an incomplete dislocation of hip, we can see. So क्या होता है इधर, the femur head remains in the acetabular cavity, but the ligaments will be stretched here. The ligaments will be stretched. We can say the teres ligament that will be stretched in this condition. So incomplete dislocation. So dislocation will be there, but it is not complete, it is incomplete. Okay, next is dislocation. यहाँ क्या होता है, complete dislocation can be seen. Hip dislocation in femoral head will lose contact with the acetabular cavity. So यहाँ क्या होता है, वो पूरा जो femur and acetabular का जो contact रहता है वो पूरा अलग हो जाता है. This is a complete dislocation, we can say. These are the terms we can remember. Next, so यहाँ आप देख सकते हैं कि नॉर्मल जॉइंट कैसे रहता है. द फीमर इज completely settled in the acetabular cavity. In the acetabular cavity. Okay, in the dislocation, so we can see the femur is out of the acetabular cavity. Femur is out of the acetabular cavity. This is the main difference. Next, causes, if we see, what might be the causes? It may be an accident, as we have already seen. It is a congenital disease and may be hereditary by acquiring from a first generation. So the assessment plays a main role in this